even abroad. Okay. So am I audible, audience?
It's clear, ma'am. It's clear.
Loud and clear.
Okay.
Yes, ma'am.
Yes. Thank you. Thank you so much. Yeah. Can I share my screen, sir?
Madam, I made you co-host, ma'am.
Yeah. Yeah. Okay. Okay, sir. Okay. So today, the topic allotted to me is regarding the warning signs of mental health. And so this is a topic, it is really very vast. Okay. And before going to my topic, I really wanted to tell few of my things. See, many people, especially Mr. Shivkumar sir, will be telling many a times about like everybody can be counselors, but everybody cannot be psychologist or psychiatrist, right? Anybody can be a life coach, but not everybody can become psychologist and psychiatrist. So I would like to know what do you all people think about this, because that is very important according to me. Because when as a large we think about the society, if we really want to bring some change in society, and we have to reduce the stigma about psychiatry and psychologists, like that that stigma is there in India, that before going to any psychologist or psychiatrist, they think 100 times. They don't seek help immediately. This is where our problem is. So this is where I think EmoCare is really doing a very, very good job. And when I got to know this, I thought like, yeah, I should at least contribute a little to this thing. That's why I thought like I volunteered to do this thing. Okay. So according to me, I'll just give you a glimpse. Okay. See, there are many rehab centers running. There are many small rehabs everywhere in India. So there many people, apart from like professional people, non-professional people are working, and they themselves think as like counselors. Okay. And like they would have got some training, like they I think even EmoCare would have trained some of the people. Okay. They can themselves, if they have some investment, they open a rehab center and they try to admit some few addiction patients, and they try to counsel them to quit alcohol, other drugs, everything. Okay. But even according to rules, yeah, and Mental Health Act, there should be a regular psychologist there, and at least visiting psychiatrist there. That means role of psychologist there also, it is very, very important. Like there should be a complete like in-house psychologist, right? And at least weekly visiting or few hours visiting psychiatrist to monitor all these things. So this is the hierarchy. So we being psychiatrists, we are like very few in number. Not many colleges in India, they have psychiatry seats. So we are in thousands, not even in lakhs. So next comes the MA psychology seats or MPhil psychology, clinical psychology seats. And even that is very limited. It is not like every district or every state has many seats, right? I think you all know this. So now we have to take this responsibility to spread this awareness among public about this mental health. Only then that we can really prevent suicides. And now it is like young age. See, between like teenagers, it's like 15 to 30 years. This is the most commonly involved age group. And it is the fourth leading cause of death in India. Okay. So if I want, this is my slight introduction. Okay, and I have done my MBBS from Mysore Medical College, DPM from JJM Medical College, Davangere, and DPH from Annamalai University, like Tamil Nadu. Okay, and I have done my fellowship in de-addiction medicine in NIMHANS. I think you know about NIMHANS. It's in Bangalore, a very big institute for neuroscience and neurosciences. And I am currently pursuing a dementia course also, because even in old age, the suicides are increasing, and the morbidity is increasing in old age. So that is under IDASA, that is International Dementia Academy, South Asia. I'm doing this course currently. Okay, so I'll go to my first slide. Sir, there is some problem. Huh? So coming to introduction. Okay, in psychiatry, the signs and symptoms, they are not as clearly demarcated like in other fields of medicine. Okay, they often overlap. See, it's like for example, a patient can be anxious at the same time depressed. That means like he may be having low mood, decreased sleep, decreased appetite. At the same time, he may be having some panicky symptoms. Panicky symptoms are like trembling, pounding heart, and sweating, and sometimes he may even lose consciousness. Okay, so this is very important thing. So many patients ask, like, what is our diagnosis? Literally, it is very difficult to tell that you have only one single diagnosis. Many a times, many people will have symptoms here, there. Okay, and because of this, disorders in psychiatry are often described as syndromes, a constellation of signs and symptoms that could make up a recognizable condition. Okay, so what are the signs and what are the symptoms? See, signs are what I can see. It is seen other than the patient. So it is their signs are any indication of a medication, a medical condition that can be objectively observed. That is by someone other than the patient. It is not seen by the patient. Okay, these are the signs psychiatrists observe in patients. And symptoms are, they are the merely any manifestation of a condition that are apparent to the patient. That is like usually patient tell us. So when they visit, they come to a psychiatrist, they start telling the problems they have. Like, madam, I am unable to sleep, I'm unable to eat, I'm having some relationship issues, and they start telling their problems. So these are the symptoms. And yeah, this is a very important thing, very important concept. Okay. Now, I would like to know, sir, are everybody in this group are psychologists, or there are other people other than psychologists also?
Ma'am, this may be a heterogeneous crowd, but
Okay.
the thing is, ma'am, we are not what do you call, providing certificate citing that they will be able to do the counseling and all.
Okay,
So
sir.
we
Okay.
can just go ahead with the normal aspects, ma'am.
Okay,
And
sir.
we have psychologists, we have I think even 3 doctors are also there. So
Okay,
it's
sir.
a mixed crowd, ma'am.
Okay, sir. So this normality, see, if we want to tell some person is having some issue, so we should know what is his base level. So there is a condition called bipolar affective disorder. Okay, for example. So in that condition, so patient has bipolar things. Like once a patient can be in manic stage when his energy drive is high. When his energy life is low, he will be in depression. So it is bipolar. That means 2 poles of the same disease. Okay. So in this case, tell me what do you think is normal? Okay, see, the definition is it looks simple, but if you really want to see in your patient, okay, I'll just give you an example. Okay, just any psychologist, I want you to volunteer so that I can demonstrate it.
You want me, huh?
Yeah, Ramya, right?
Yes, ma'am. Yes,
Yeah,
ma'am.
hi Ramya, hi. So, do you counsel patients?
Yes.
Okay, okay. So, when they come to you, okay, ma'am,
Uh,
it's like I'm giving you a scenario. Okay. So, a new patient comes to you. Okay. And he or she starts telling all the symptoms to you, like whatever his problems. Okay. I mean symptoms because I am a medical person. It's like
I
I'm
lost the
just,
voice in between.
yeah.
I'm
Am I
really sorry.
audible
I
now?
lost the voice.
Hello.
Yes, ma'am.
Am I audible now?
You're audible.
Yes, ma'am. Yes, ma'am.
Okay. Okay. Ramya, I'll give you a simple scenario. Okay. So if some patient comes to you, okay, how will you know what is his normal personality? How will you know that what is his problem? Like, how will you decide whether he is normal or not? Or when will you decide?
Usually, the family members.
Yeah, yeah,
Yeah.
tell me, tell me.
The first-hand information we get from the family that the onset and offset of their extremes are told by them,
Okay.
and we cross-check with them, and we ask them to bring at those abnormal times
Yes,
also to
yes,
verify. In between, I also call them for a normal time on a different sake, for a different sake of reason, to not inform them that for the sake of counseling or talking
yes,
to them, to check the extremity of their
yes,
condition.
yes.
That's how I do cross check. Sometimes their answers and they also don't match. Most of the times, if it is a bipolar thing, the onset and offset do usually match with the family members when
Yes.
they
Yes.
inform them.
And if you can give me some insight about like this bipolarity is, it is becoming so very common. See, you see a patient once in mania, and you never know like when he had depressive symptom or that, because they would
Yes,
not
ma'am.
have
I have a case
identified.
to share.
Huh. Can you share it?
Uh, yes, ma'am. I've got a mother who with a child who is studying like second class. The first
Okay.
time when she met, she was saying that she was like on a higher side of her energy. Like she's very energetic. She makes her
Yes.
child to do all the school projects. Usko naya school mein dali, and then she got first prize, and she could help that child for everything.
Yes.
All great things were there on her side. When I
Yes.
met for the other onset, which is a very low side, she couldn't even help herself to switch on the stove of the kitchen. It's been for days together. She couldn't help herself at all.
Okay. So what will you do in this scenario? As being a psychologist,
No.
what is your role here? I really want to tell this only. See, my objective of taking a class today is this. So
This
in this
actually, this
situation,
particular lady has come from the psychiatric surveillance, and she has shifted to the new place. So she couldn't find anybody a psychiatric support who can speak Hindi for her at that time.
okay,
So her
okay.
family members have brought for the reason to be with me, at least at the safer note, not to be an extremities. But
Okay.
a psychiatric support is always needed to give that medication. Whenever she stopped medication, also these onsets were heavily shown on her. I
Yes,
made sure that
yes,
she was
you're
practicing
absolutely
these
right.
medications.
You're
Thank you,
absolutely
ma'am.
right. That is
So
what
the
is very
medication
important.
practice, she dropped it.
So now I am telling you, see, it is not only the role of psychiatrists to tell them to be on proper medications, it is even the role of psychologists to guide them. Like they need, see, bipolarity is such a condition, if they leave medication for some time, they relapse. And once they relapse, the symptoms are more severe than previous one. So that
True,
is
true.
very important. See, you have already experienced it. I'm really grateful to you because that is what I wanted to show. So this normality is like very difficult to understand. So when you first see psychologists, especially when you first see that patient, you feel so happy. See, she is such a great lady. She is over like a confident personality like that. But in reality, that is not so. She is her normal functioning is different from that, and this slight fluctuations whatever you told is this is hypomanic stage. Okay, so in mania that will be more severe. They even talk that I am the prime minister, I am the minister, and I am going to contest for elections. It will go to that stage. Okay, so what you told is hypomanic stage. Okay, it is in between like normality and mania. Okay. And yeah, you told me you what happened to that lady after that? What did you do?
So
So she left
the lady,
Korea.
same thing.
Hmm.
Yeah, she got a doctor from from North India. She came to South India, where those medications and the doctor she met was not the same team was not there. So she don't want to meet anybody new. So the
Yes.
onset and offset were because of dropping that medicines. Then
Yes.
finally, I could make that husband understand that how important the medications are, and my
Yes.
counseling support has extended to the whole family, not to get disappointed because they got a very little
Yes.
lovely child.
Yes. This is what another
And
point I
we
wanted to tell. Yeah. This family therapy, we call it as family therapy. And you are all therapists also. Okay. So CBT will be done to the patient. But at the same time, I feel rather than CBT, family therapy is the most important thing we have to do to every patient. Because if family understands what is the nature of the disease and what is causing it, like and how to handle it, then they will not come to this stage. And this is very, very important for all of us to understand. May it be any person. Okay. It is like even simple person can understand when this person is normal and when he is hyper and when he is like low. So this is like, yeah, very important thing. Thank you, Ramya. Thank you so much. You have given a very good case example so that I can explain what is normality. Okay, thank you. Yeah.
And they have been asking one question which was always tricky to anybody to answer. Is it
Yeah.
hereditary? Uska mummy papa ko hai kya?
Yes,
Or is it
yes,
will my
100%.
children do come?
Yes, it is 100% hereditary, and especially BPAD and schizophrenia. These two conditions are hereditary. Like many people, at least up to 90% people, they have in their genes, and they are prone to give it to their children. But I'm telling you, BPAD patients are the people who are really doing very well in their life. And I'm telling you this also, if they are properly treated, okay, you will see that they will like they are like they do their own businesses. They can do their they can be big scientists.
Energy
They are working.
volcanoes.
Yes, and they are scientists in ISRO, everything. And I'm telling you, if you like get to handle such a case, you will feel so happy because you have handled them and you feel that, yeah, you will have that satisfaction. Like I have cured this person, and see, my patient is in that position. Literally,
So
BPAD
it is
patients are
challenging, yet
really
it
very
gives
good.
more satisfaction.
Yes, challenge
Yes, ma'am.
always, everything. See, life is about challenges. If you take a great challenge, you will get great results. Simple. If you don't take risk, you don't succeed. Right? Okay. Yeah. Thank you,
Thank you,
dear.
ma'am.
Bye.
Thank
Bye.
you.
So I have understood. I need not read this. Okay, just for the sake I have put. But this WHO, it defines normality as a complete state of, it is a state of complete physical, mental, and social well-being. Yeah, this point I would like to tell, because it is like physical means you everybody know, like physical diseases, diabetes, hypertension, cardiovascular, renal, kidney, brain, other things. Mental, all of you know, as main things I'll tell you: depression, anxiety, schizophrenia, BPAD, addictions. Okay. And the social well-being is how you interact with your surrounding people, neighbors, and how you behave in your profession, and how you behave with your colleagues. These everything comes under social well-being. So normality is, it defines like you should be in a complete state of physical, mental, and social well-being. But again, this is limited because it just explains us absence of physical and mental disease. That's all. But when you come to another thing called personality disorders, this is another big topic. Everybody will have some or the other personality trait which will be disturbing to others. Okay. So if I talk about this topic, I think I cannot end it before 2 to 3 hours, because every person will have one or the other personality issues. Right? I think everybody will agree with this. Can you raise your hand? Like if anybody don't agree? So I think everybody agrees. Okay. So that means like normal when we are defining mental problems, we see the baseline personality. That means what were they before the illness started. Okay. For example, some persons may be introvert and some person may be extrovert. So we have to take that into context before diagnosing somebody with BPD or depression or MDD or schizophrenia. Okay. So coming to this warning signs. Okay. Now here is like very important things. Many of you people could have also been like experienced these things. I'll come to see. Three things are there. One thing is general features. It's like general thing. And another is bodily symptoms, signs or symptoms, and behavioral signs and symptoms. So what are the general features? See, first thing is unrealistic attitude towards life and people. They don't have realistic thing. Okay. For example, I'll just give this example at a later stage, because if I go into this again, it will be a problem. Suffering from mental disturbances, disorders, ailments, and diseases. So here comes the disorders. I'll just explain within 2-3 minutes. See, MDD, that is like major depressive disorder. We define it when there are symptoms like low mood lasting for more than 2 weeks. This is the definition. See, everybody will be in low mood, under stress, in one or the other part of their life. Okay. But not all the things can be called as depression. Okay. So we call it as depression only when the low mood exceeds for 2 weeks or more. Okay. And in depression, you have other symptoms also, like the sleep will be disturbed, appetite will be depressed, there is no urge to eat. Okay. So these are the minimum symptoms. And bipolarity, we have already explained. Okay. So these manic or hypomanic features, depressive features. So in manic features, I'm going to tell you, okay, people tend to like react in such a way that many a times it looks normal. I'll just give you an example, a recent case, whatever I'm seeing you. So everybody, see, he has done a diploma in mass communication, patient. Okay. He wants to change the society. He is working towards a cause. He is telling, I want to reduce corruption in India, which is the biggest problem. So tell me what you people think when a person tells this. That too, he has done mass communication. So you can put it in chat box so I can see that. So what you people think when he tells this? Do you think that he is in mania or hypomania? You don't think. Okay. It extends. He starts posting some pictures, taking some pictures wherever he sees that some activities are going, and he starts posting on Instagrams, Facebook, all other social media. Okay. So he acts out on that next. So first stage is he thinks, I want to change the society. Okay. Then he tries to act out. Okay. Smita is telling unrealistic. So unmute your mic, Smita. Okay. Mudassir is telling depends on the person's state, some traits and behavioral pattern might have. Yes, definitely. This is also correct. Okay. So some personality traits. Smita is there?
Yes, ma'am.
I'm there.
Yes.
I'm there.
Yeah. Okay. Tell me, Smita, how it is unrealistic? Hello? Hello? Hello?
Yes, we can hear you.
Yeah. Tell me, Smita, how it is unrealistic? Why do you think it is unrealistic?
He wants to change everybody with his efforts.
Hmm.
That's why I think it's unrealistic. It's not
Okay.
one person who is trying to change the entire society.
Yes, that is one point. Next.
The next is, how can you do it through mass communication?
Yes, yes. Yeah, see, he can do it. See, the thing is, he can do it through mass communication. Like when he like gives it in newspaper and other things, he can do it. Next story I will tell you. These 2 points definitely they point towards that he is having some like delusion. Not definitely it is a
Yeah.
belief. Okay. So next part I'll tell you, which
Okay.
will confirm that it is unrealistic. Then you know what he does after posting it on social media? He tells that I would like to contest in elections. Out of the blue, out of the blue. Everything, these things, all these symptoms start within a days or 1 week. Within 1 week, he does all these things. Okay. So that time you have to think that this is not the right thing. Okay. First starting, many people thought it is normal. Okay. Everybody will think it is normal. Okay. Well, yeah, he is such a good person. He might change. He is having some mass communication degree. Maybe he knows how to communicate to the public. But when he is starting acting out, okay, so he wants to become a minister, and then once he becomes minister or like a chief minister, he thinks that he can ban corruption everywhere. Okay, so now you tell me, is it really possible? No.
Possible. It's not possible.
And if I want to talk about the current Indian politics, people started telling that BJP is not working properly, Congress is not working properly, and now Kejriwal came after that. Punjab, I'm currently in Punjab, Aam Aadmi Party came, and I think now I am seeing that it has worsened than before. Things are worsened than before. So it's like unrealistic expectations. Okay.
Yes.
Yes.
So when a person starts thinking out of the blue something, that is where is the early warning sign for you to identify something. And I'll tell you what happened next. Within 1 week, this patient progressed like this, completely high. And you know where he ended? Suddenly he is into depression. When he got to know that, yeah, he couldn't do anything to the society. Yeah, I have to kill myself. Just imagine where it started and where it is ending. And I'm telling you, this bipolarity, it need not be like some days or some months you will have mania, he'll come to normal, then he'll go to depression. No. Both the symptoms, depressive symptoms, manic symptoms, can be present at the same time. So this is what is very, very, very dangerous. So we have to identify this. It is simple. When some people really talk to him, they easily get misled. They think, yeah, he is depressed because he couldn't do something to the society. He has done some degree thinking that he will do something to the society, and he couldn't do. That is why he is going to depression. No. He had so much thoughts, he acted on it, and he wanted to contest in election, and suddenly he started developing thoughts of depression that when he got to know that he couldn't do. Okay, so this is the early sign. We have to identify people when they are going out of the track easily. There only we have to pick up, and we have to, and at this stage, people in this stage should be treated by a psychiatrist. Definitely, psychologists cannot handle this situation. Okay, and there will be some issues which can be easily managed by at the psychologist level only. That is like some relationship issues, ongoing relationship issues, ongoing personality problems. Okay, these are also like mental disturbances only, but these things can be managed at the psychologist level. Okay, even if you don't refer to psychiatrists, we don't tell anything, because there are many number of people who really need our help. As I told you, like since psychiatrists are very less, Definitely, I'm telling you, even in Punjab now, there is vacancy for at least 20 to 30 psychiatrists. They are literally not getting psychiatrists. We have so much opportunity. And if you know some people who are really pursuing MBBS course, tell them to take psychiatry. They will never be jobless. They have so much opportunity to work. We have n number of patients here. Literally. And definitely, we really don't have so much time to counsel, sit and take CBT, DBT, or motivational interviewing. No, you have to do that. That is on your part. And we can definitely don't have time for personality issues or traits and like other relationship to solving these problems. So solving some simple familial issues, you can do family therapy and you can solve it at your level, right? So these are some of the things which can be solved at your level. And I'm telling you one more thing. Don't ever think that this symptom is very, very less severe and this will not lead to suicide. No. In psychiatry, I'm telling you, simple thing. Some person, I'll give you an example. I think a 21-year-old girl, okay, she was doing her master degree, okay. She asked something, she was in relationship and relationship didn't go well and something went wrong between them, and suddenly she went into depression and she attempted suicide. So you never know. Like, I'm not telling that all the relationship issues or personality traits you can handle. Such cases where they are unable to tolerate and where their personality traits before only is so like pathetic, okay, such cases needs immediate attention with the psychiatrist, okay. And here are some examples I'll give, okay. Always dissatisfied with his achievements and seek over perfection in his or others' work. So this is another very big important thing, okay. Many people in Bangalore also, okay. So IT job especially, it is so stressful. They always compare themselves. Always. I want to go go to this position soon. I want to go to that position soon. Always in competition. No. So this also will lead to depression. And sometimes if it is very severe, if the person cannot take that lightly, then he goes into very severe depression. And this is there. And another situation is live in the world of his own imagination and fantasy. Here it can be sexual fantasies and it can be anything, okay. So they live in their own world, okay. They have some of them aspire to become an astronaut, and some of them aspire to become a pilot, but in reality it will be very difficult for them, maybe because of financial reasons or any other thing, okay. So when such thing doesn't happen, so this might be another reason why young people tend to attempt suicide. And failure in setting a proper level of aspiration. This might be another reason, as I already told, suffering from frustrations, unresolved conflicts, and other stressors. And another thing is this one. Always they remain in a state of over anxiousness and tension. That means doing any work. For example, it may be a simple kitchen work, okay. Housewife, she'll be always in that in that tension or anxiety, like, yeah, I have to make food for my kids, I have to pack them, I have to send them. She thinks that she is the only person who has to take care of the whole family, but in reality that is not so, right? And during such time, if husband doesn't support her, so she will become, no, I don't want to leave now. My husband doesn't listen to me. This is another simple example. And many a time, even this case has come to my clinic many a times. Okay. And lack of enduring power and tolerance. So if people cannot tolerate whatever is happening in their life, okay, when they don't have the tolerating capacity, any stress can become a warning sign. Like, for example, they lose somebody like close relative, father, mother, brother, sister, husband, wife. Okay, that time it can be very difficult. And lack of decision making capacity. Yes, and this is another very important thing. Many people tend to confuse themselves. They don't know in their career what to do in future. And now, as I am doing, sometimes when I get time, I'm doing even online counselings. Like I take therapies. I'm not telling I don't do therapies, because it's like I think therapies will give me more pleasure, so I am doing. So I have one patient who is like so much confused after graduating her degree. Okay, she doesn't know where to, like what she has to do in masters. Okay, she's so confused. She knows, if I do MBA, I can be this. If I do MCOM, I can be this. If I do other course, I can be this. But she doesn't want to commit to one thing, because she thinks so much further away. See, you have to think and do something, and you have to work on that, and you will definitely get a job. You never know what job you will get and how it will be till you come out of it, right? So she thinks all the future at, like, before doing itself. Okay, that is another big problem. And when she has even not applied for colleges, thinking and wasting her time. And after that, she's so depressed and she's telling, Madam, I don't want to leave. I don't feel like leaving. I just want to end my life. And when people tell that I'm frustrated, I really don't want to leave, I want to end my life like this, so we should not take it lightly. Okay, so we have to take everything seriously. And poor self-concept and achievement motivation. And this is another thing, emotionally unstable and easily upset. So this one we call it as borderline personality disorder. And I want any volunteer to tell something about this personality. I think many psychologists know about this borderline personality. Rifa Wahid.
Yes, ma'am.
Yeah. Tell me, Rifa Wahid.
Yes, ma'am. Borderline personality disorder is also called emotionally unstable personality disorder.
Yes.
In this disorder, the client or the patient is emotionally unstable. He can also be impulsive. He has emotional dysregulation.
Yes.
Yeah, he can also have self-harm.
Yes. Very important is self-harm. And this self-harm is different from the other self-harm. Tell me how it is.
Yeah. In this disorder, the patient who does self-harm reports that after making cuts or doing self-harm, he felt relief from the emotional pain.
Yes. They do it to relieve their pain. That's all. And once they are relieved, they will be back to normal.
Yeah.
And this one, what are the other differences in self-harm in this case and normal depression case?
Ma'am, in depression, self-harm can be with the intention to end the one's life. In borderline personality disorder, the intention is not to end the life. The intention is to relieve from the pain. Actually, the stress hormones get released when the blood flows from the person's body, and the pain gets relieved, and that's why the mind feels relaxed after doing self-harm.
Yes, you're absolutely right. And one more observation you would have seen, borderline personality people, they do it in front of others to gain others people attention.
Yeah, but ma'am, I want to say something about it.
Yes.
Ma'am, I have seen some patients also who do this when they are alone.
Yes.
Many
Okay.
patients
Okay.
in isolation when somebody knows about, when nobody knows about it, because they want to get relief from the pain. It's
No.
not all.
Sometimes it can be both, but
Yeah,
in case of major depression and other things, they never do it in front of others.
yeah,
Okay,
yeah,
because they really want to end their life.
because
And
it
huh,
is their lives. Yeah, thank you.
yeah, really, you have explained almost all the points of borderline personality disorder. Thank you, Rifat.
Thank you, ma'am.
Yeah, thank you. And I want another participant to raise their hand for the next thing. This is really very, very, it will be very good experience for you. Apprehensive, suspiciousness, and insecurity. I just want to know any people who would have seen these people. Again, Rifat only has raised. Can anybody is there, or Rifat can continue? Okay, Rifat, you only can go on.
Yeah, ma'am. Suspiciousness and insecurity can be seen in psychotic people.
Yes.
Yeah, there is also another disorder, personality disorder, which is called schizoid
Yes,
personality.
yes, schizoid personality. Yes, yes, yes.
In that disorder, there's suspiciousness and insecurity also.
Yes. And can you give some examples? What is
Yeah,
like suspicious?
yeah. For example, there is a concept called paranoia, a condition.
Huh.
Sorry.
Yes,
Yeah,
yes.
that is seen in psychotic patients or schizophrenic patients.
Yes.
They always feel suspicious that the other person is trying to harm me, or the other people are backbiting about him or her. It
Yes.
can also turn into a persecutory delusion further.
Okay. Okay. Yes. Very good. So you have given the explanation really good. I'm going to tell two things. You be there, Rifat. Okay. I'll
Yes,
just explain two concepts here.
ma'am.
Whatever Rifat told, everybody identifies this easily. This paranoia, many people can easily identify. Okay. There are like two delusions which are very difficult to identify, and people think it is real. That is delusion of reference and delusion of infidelity. Okay. So these two things I want to discuss in this platform, because many psychologists will come across this. So, Rifat, can you tell me what is delusion of reference? That is, I'll tell you. Delusion of reference is people think, yeah, someone is seeing me, somebody is following me. So they refer to somebody. Okay. But in reality, there will be no such person at all. Okay. So they will be telling that, yeah, somebody is following me since so many days, and somebody is staring me in a different way. Okay. Especially when there are some social gatherings or anything. So they think that, yeah, that person is staring me in a different way. This person is staring me in a different way. Especially when boyfriend, girlfriend is there. A boyfriend, when he is drunk, when he's having he's under drug, when he has consumed large amounts of drug, he starts suspecting his wife, telling that maybe he is seeing see, that guy is seeing my girlfriend in a different way, so this my girlfriend might be having an affair with that guy. I don't know. So she is also sending some signals to that person. So tell me, I am seeing a doctor couple, sorry, doctor in doctor relationship. This I'm seeing now, right now. I'm seeing this case, and it is like I am facing such a difficulty to explain it to them that this is delusion, infidelity reference is happening, but you're not understanding. And you know how much fight is happening between the in between boyfriend and girlfriend. Relationship issues are coming, and he started telling that you are having affair with that person. And you know, now he has started even telling to such an extent that you are having affair with many people in this bar. and now you are cheating me. Okay, so these things, when such cases come to you, have you seen or encountered these cases? So if anybody comes volunteer, like if somebody who has seen such a case and where you had some challenges, we can discuss it, rather than me telling my how difficult it is to convince them that it is delusion. Especially this happens when they are drug addicts and when they are under the influence of alcohol or any other substance, and especially when they take LSD, that is lysergic acid deagitate, that is very, very dangerous, and their hallucinations or delusions are so much that you just can't imagine. And even heroin or opioid, all other drugs, they when they go beyond certain level, we call it as a dependence. Okay, see, and this part I forgot to tell, this drug addiction thing. So this is another very, very important topic, because everybody is consuming one or the other drug. And
Is
even
LSD
in this,
available in India, ma'am? LSD?
what?
Is
Yes,
LSD really available in
everything.
India?
Oh,
Oh,
everything is available. I'm telling you, I have seen all the cases: LSD, amphetamine cases, heroin. And right now, I'm in Punjab. I'm seeing 300 cases of, means 300 cases per day of opioid, heroin, alcohol, and other drugs.
yeah, I heard that in Punjab the drug addicts increased because there was a big boom and the farmers got a lot of money and the youth is getting corrupt.
Yes.
I've heard it from people that a lot of
Yes.
drug addicts are there, and what you're saying is substantiating that.
Yes, definitely. And I came because I did my fellowship in de-addiction. I really didn't had any option to work in Bangalore, because there not much addiction is there. Only addiction majority is alcohol there. Okay, so alcohol we have already, like, I had so much experience there. So I really wanted to experience how, means I want to gain my experience in my field of interest. So I shifted from Bangalore to Punjab only for that reason. And since 2 to 3 years I'm staying here, I really don't know when I get bored and I'll take some other subject. And next year I'm planning to take child and adolescent psychiatry. So when I take that subject, I can move to some other city. So I really want to, like, master in as many subjects as possible. And as I'm doing dementia course, and now I am identifying dementia problems also. That is, like, dementia means in many people tell memory problems, but it is not only memory. There are many behavioral problems also in old age. So those are also called as dementia. Okay, so Rifat, you are only talking, right?
Yes, ma'am, I'm here.
Yeah, so have you experienced, tell me soon, because it's almost 8.
Yeah,
have you
ma'am.
experienced this case, like boyfriend girlfriend suspicion between themselves?
I have actually I have seen a case in which
You know, I'll tell you one more point.
yeah.
We get confused whether it will be very difficult many a times to tease whether it is delusional or is it really there. Many a times it will be there. They would have cheated their partners.
Right.
Nowadays cheating is very common. You
Yes.
really don't know whether that is true or like
This is the delusion. Yeah, that's true. I have seen this time there is a case that comes in my mind. I have seen a case in which the boy was really very suspicious of her girl, that he is talking to many people or many boys. She is chatting guys, and he was constantly checking her WhatsApp and asking her with whom you are busy on call, with whom you are busy on what. She had to send the screenshots to him, and that relationship was very toxic for that girl. He was also abusing verbally.
Yes.
So,
See, in this case, I'll give you example in this case. See, now normally I can talk with my colleague. Okay, I will talk with my colleague normally. I will send him some messages. I will be discussing some things with my colleague. Okay, boy colleague. Okay, male colleague. I'll be discussing. Okay, if my husband starts suspecting about me, so how should I react? Now, in same case as you are telling. Okay.
Yeah.
it is very, very difficult. See, he will be checking your messages, he will be seeing you, where you are going, what time you are coming, everything he'll be checking. Okay.
Yeah.
Ha, there comes such a stage that it will be so difficult for you to tease about it. That's where I think you have to send them to psychiatrist, because that is very difficult for you to tease it.
Yeah, exactly. That happened with that
And
girl.
you cannot handle that, because it will be out of your hand. Like it is like they don't understand even if you convince them 100,000 times.
Yeah, very right, ma'am. He then used to abuse her verbally,
Yes.
using bad language, bad words, and that
Yes.
relationship ended. And he was not even ready to leave and that relationship. He was
Yes.
constantly texting her, and finally that ended. But it was a good decision of her to end that relationship.
But sometimes you are telling it is good decision of her to end that relationship. But what I tell is, if he is really under some other, if he is having some psychotic problem, okay, if he is not treated, okay, he might be truly loving her, okay, but because of his psychotic problem he might be suspecting her. At this situation, what will you do? That's what I'm telling you.
Yeah, you're very right. That might be the problem. Some
this
mental.
this is the situation in my case now. Okay, he really loves her. Okay, that love is true, and that is almost since their childhood they know each other and they love each other since childhood. I can tell you their love is since 8th standard. Manushi wants to add something. Please go on, Manushi.
Hi, ma'am. Manushi
Yeah,
this
hi.
side.
Yeah.
It's very important for both of them to understand that these are the symptoms of the disorder, and this
Yes.
is not him actually probably part of his personality. It's a
Yes.
part of the disorder, and this is a symptom. And
Yes.
it's very important for him to have the acceptance or the knowledge that this is one of the symptoms. So once the acceptance like
Inside
once
will not be there. One second, Manushi. Inside, we call it as inside. That is,
inside.
when psychotic person are there, they don't have insight.
No, initially,
Unless you treat, they will not have insight.
Oh.
They will not have insight. You try. I'm telling you, when such a person comes to you, you please try. Okay, you tell them 100 times. Okay, I will give you the example. I'm telling him, please, you leave your amphetamine substance use. My patient was amphetamine user. I told, because of that you are having so many problems. I did not tell that this is a delusion directly. Okay, I told him, because of your amphetamine you are having some issues, please leave that. So he started suspecting that girlfriend is making him mad. So another one point started. He was all
look,
suspecting and other things. Now he started telling that he is making me she is making me think mad in others view. So how will you do? That insight is very difficult for you to imbibe into them.
yes, it is very difficult, but after taking medicines, like antipsychotics, it is
Yes.
once he is at a stage where he can be counseled, and
Yes.
medicines are showing their effects. So
that is what I'm telling you. We have to start medicine as soon as possible for this patient. Otherwise, I'm telling you, as Rifat told, relationships will easily break. But
yes,
before it breaks, okay, they come to us and seek help with just a simple antipsychotic with risperidone, quetiapine, or anything. They will be cured within few weeks. 1 or 2 weeks, he'll be all right. He will just start thinking that, yeah, I am wrongly thinking about my girlfriend. So this is where I think psychologists should be very careful, and they should identify such cases. See, as Rifat told, sometimes it will break up. Okay. So maybe it is good for that girl. Okay. Yeah. One way, as Rifat said, that girl is bach gaya, wo bach gaya. But what about others? See, he is psychotic. Unless we treat the psychosis, his psychosis will never go. See, psychosis will not be cured without medication. But sometimes depression will be cured. some minor depression to moderate depression, even without treatment, it will go away, okay, as time passes. But psychotics has to be treated.
Yes, psychosis can be managed. So it can be managed with the help of medication and psychotherapy put together. So
yes,
yes, and like you said, and I said that psychotherapy follows medication when it comes to psychosis, because it's very important for them to have the effects of medication before counseling can be done, because they're not at a stage to understand or comprehend or have an insight, like you said.
Yes. And one example I am telling you, same drug addiction, one patient, he attempted suicide because his girlfriend did not like, he had suspicion over her, and his psychosis was not treated. So he thought his his love was very true, and he had a delusion of infidelity, that his girlfriend was cheating. So he attempted suicide by overdosing himself. He overdosed so much drugs and he came to hospital. And then I had to admit him, treat him, and I had to treat him for a week. He was completely disoriented and all other withdrawal symptoms. I had to manage. And after 1 week, when we sat, we counseled, and me and counselor took so much energy to counsel him, and then he was all right. So such cases, role of psychiatrist is also very important. Psychologist is also very important. We have to make him understand, and we have to leave him into the society. Otherwise, the other girl, see, one girl, he will leave. So same thing will happen to other girl. So other girl, it will be going on unless you treat it. You might have seen, I have seen such case. Many psychiatrists or psychologists, they would not have diagnosed him properly. It will be going on. And when I ask him why you have had so many relationship breakups, he will be telling the same reason. Madam, she cheated. But the reality is, he is not understood. He is thinking that everybody is cheating. It is there here. His thought is the problem. But unless his thought is not clear, how will his relationship be okay? So being a psychologist and psychiatrist, we have to think in complete all the perspective and then decide our treatment. Okay. Yeah. Thank you, Manushi. Right. So, and another important thing is self-critical and empowered with a feeling of guilt. This guilt feeling, I am telling you this part, major example is, one thing is, many people nowadays, I don't know, because of familial issues, I'm getting so many calls, HIV phobia, and many people are having sex with unknown works, like female sex workers. And they go have sex with female sex workers, and they end up in having guilt. And they start having feelings like they might contract HIV. Sometimes they will use protection, sometimes they don't use protection, and they end up, and then they start calling us. And I am seeing 2 to 3 such cases daily. If I do online consultation, I'm getting such calls, because I work in Dr. Safe Hands. That is one portal where they do HIV counseling, they give PrEP medicines and other things. I get all such cases. So much guilt they have. I have to treat taking them as for depression. Otherwise, their guilt will not be cured with just normal counseling. They only go to some sexual workers and they get into that part. And some people have gone to such an extent, madam, I have cheated my wife. My wife was so good. I cheated. So I have to end my life now. So these are also the early signs of suicide. Okay. And a lack of self-confidence and willpower. This, I need not explain about this. Everybody knows. It is a very simple thing. Inadequate adjustment with the self and the environment, physical, social, professional. This I explained it in social well-being. Okay. Coming to bodily signs and symptoms, I'll take another 5 minutes for this. Okay, and behavioral symptoms another 5-10 minutes, and I'll wrap it up. So this is another very important topic. As a doctor, I should tell you, many a times, I'm telling you, 60 to 70% of times, again, market 60 to 70% of times, everybody sitting here will have one or the other mild bodily symptoms like backache. Everybody has, 90% people has change in appetite, some chest pain, constipation, diarrhea, high blood pressure, extreme tiredness, general body ache, light headache, okay, some sexual problem, some sleep problem, some stiff neck, some sweating, some upset stomach, some weight gain or weight loss. This everybody has, okay, but everybody starts thinking that they have some physical problem. I'm telling you, yes, I'm not telling that you are not at all having physical problem. Yes, you will be having some physical problem, but always it will be with mental problems. That means backache, I'm telling you, I don't know how many people you know about Dr. B.M. Hegde. He's a very well-known physician. He has clearly told, okay, this backache, we have one muscle called erector spinae, okay, everything, okay, the strain in that muscle will cause backache. That's all. It's like because of the strain, like tension in your brain, okay, that muscle gets contracted. That is the major reason for backache. But many people will get unnecessary x-rays, lumbar x-rays, and they think that there is disc is there prolapsed, and they get operated for that. And I'm telling you one example. He has clearly told, one person who was having only mild backache went to some orthopedician, and he just told there is disc prolapse, you have to get operated. And during operation, he had one complication. Okay, he was paralyzed. So he just went for backache. He came out being both the legs paralyzed. Okay, so backache can be easily cured if you relax yourself. Just do mindfulness exercise, pranayama, everything will be fine. And just your posture maintain. How you see, I'm telling you, not all the pain will be same. Just your posture matters. How you sit matters. Everybody has headache, one or the other time. It is all tension type of headache. Don't think every time it is migraine or something or the other. No. Majority time, these are the things. And all these problems also, when people have panicky attacks, they start thinking that they might die. Okay, so these kind of things also sometimes, when they cannot bear all these symptoms, they start like feeling like they have to end their life. Even this simple minor things can lead to such a big decision. Okay, so do you have any doubts in this? I would like to clarify. Maybe 2 to 3 minutes I would like to clarify this, because this is like very, very important topic. I'm telling you, many people will save so many of your hard-earned money if you talk to me, or if you have any issues in this. Because many times, I'm telling you, many wrong practices are happening all over India. This is another big topic which I cannot talk on this platform right now because I don't have much time. But everybody is literally looting, and I'm telling you, our doctor profession, they are built big hospitals, and they're looting money like anything. Just because you go for one backache, they just write a CT, MRI, all other things, X-rays. They are unnecessarily wasting your money. Only thing what you need is a simple mild, some mood spray, rapid relief or something, and some exercises for that. That's it. Okay, so it starts from there to there. I just gave example only for backache. For all other things also, there are easy solutions. Any questions?
Yeah, Nivedita ma'am.
Yes, sir. Yes, sir.
Yeah, ma'am, it was very wonderful, ma'am. Ma'am, actually, 2015, 8:15, I have a session.
Okay,
So,
sir. Okay.
no problem, ma'am. No problem, ma'am. You can take it, but I have so many questions to you. I think
sir.
if you are able to spend around a question and answers, yeah,
Yes,
30
sir. Yes, sir.
minutes
Sure, sure.
next week, any time, ma'am. Because there
Okay,
are,
sir. Okay.
because one aspect is, ma'am, the work of a psychiatrist.
Yes, sir. Yes, sir.
The
Sure.
work of psychiatrist, and how to suppose even a psychologist, if at all they want to refer to a psychiatrist, what are
Yes,
the
yes.
normal methodologies to be followed? All
Yes,
these
sir.
aspects, if you are able to just give us a idea, ma'am, that will
Yes,
be
sir.
great.
Yes, sir.
So next week, any time, 30 minutes, ma'am, if you give, it will be very nice, ma'am. Now,
Definitely,
yeah,
sir.
over to you. Over to you. Yes.
Sir, last few minutes. Oh, it's over almost. Okay. So next is behavioral symptoms. Okay. So behavioral symptoms, I'm telling you, these are very important, like sudden change in behavior. So we have already spoken about paranoid thinking, that others are talking about him, and delusions or hallucinations, seeing or hearing things that others are not actually there. Okay. And alcoholism, drug abuse, or chain smoking. So you know about this. And regarding this hallucinations, I have not spoken. So this is another very important topic. You know, hallucinations, there are many types. See, auditory visual is very common. Okay. So auditory hallucinations, when a person hears some voices, see, I'm sitting in a room, but I am hearing some voices. Nobody hears in my room. I'm hearing some voices. They are telling me, they are sitting in the other room. They are talking among themselves about me, and they are telling me that I should end my life. So this is one simple example I gave you. So that a patient tells that they are listening that voices and they want to end the life. So this is one third person auditory hallucination. Okay. So during this time also, patient gets so depressed. So when he tells others that I'm listening to somebody is telling me to die, so they tell who is you telling you, and they just neglect it. Many a times auditory hallucinations are easily missed. Okay. And many times, you know, when some patient tells to their family members, see, some of my colleagues are talking about me, and they are talking wrongly about me. They are thinking that I'm such a person, I'm such a person. Okay. So what family members will think? They think, yeah, he's telling, there might be something happening in his office. That is what he is telling. Okay. But in reality, it will not be there. So identifying some auditory hallucinations, visual hallucinations is very difficult. But that can be easily picked up when you see his behavior has changed. See, you know, he will be sometimes talking to himself. Okay. So he will be hearing some voices and he'll be replying to it. So he'll be talking to some people will be muttering. So when you see that, that is a sign of psychotic symptom. Okay. And visual hallucination is they see some pictures. They tell that I'm seeing a snake. I am seeing some snake is going around here. I'm seeing someone is coming. I am seeing some knife here, like that. So they literally picturize that and they tell you. Okay. And this is very common in schizophrenia, third person hallucination, and other things. And in the schizophrenia, when it goes to severe stage, many people end in suicide, and that too early suicides are also very common in schizophrenia. And as I already discussed, alcoholism and all other drug use and chain smoking, this is like a very, very important topic for all of you. Maybe some other time I can speak more about it. But as I told you, there are three things in alcohol thing. One is many people use alcohol once or twice, that is occasional use. Sometimes they take it more, that is abuse. And when they take it to such a great extent that they have got tolerance, that is dependence. So when they are dependent, all these psychotic symptoms start. Okay. And decrease inability to cope with day-to-day problems and activity. So behavioral change will be, sometimes patient tells me, I cannot get up from my bed. I really don't want to do anything. I just want to lie on the bed. I am just exhausted and I don't want to go to office. When they start telling all these things, you should suspect that there is something and you have to interview them properly. And yeah, they sometimes patients themselves tell that they're thinking about harming himself or attempting suicide, and there will be dramatic change in eating or sleeping habits. Yeah, this is another very important topic. You can see many a times you start it like eating more and more. Okay, that to junk food, like oily food. When there is so much stress now, people tend to eat more. Many people tell, madam, in depression there will be weight loss and they don't eat. That is normally people think that. Okay, that means na yaro sathogidare. I'm telling in Kannada. So somebody has died. So I don't want to eat food. Some people it will be like that. But sometimes atypical depression, they people tend to overeat also, and they gain weight also. That is also a very common form of depression. Sorry. Anybody can study this?
Yes, ma'am.
Yeah, go on.
Thinking about harming or attempting suicide, dramatic change in eating or sleeping habits, persistent nightmares or daydreaming, reduced energy level and loss of interest or pleasure in activity formerly enjoyed, difficulty in concentrating, remembering things, and making decisions.
Okay. So, last thing, can anybody tell example?
Yes, ma'am. Ma'am, for example, if someone has faced any traumatic event, he or she can have nightmares about that event. Yes. Or if someone is thinking about doing something which he or she is not able to do, he daydream about that constantly. Reduced energy level is the symptom of depression again, and loss of interest or pleasure in activities formerly enjoyed. They have fatigability also. They get easily fatigued, or they also have somatic symptoms like pain in body, difficulty in concentration, or like they can't focus or concentrate on a particular task for a long time, and they have forgetfulness also. They have poor decision making also. They are not able to make a decision. They have indecisiveness also.
Okay. May I know who is speaking?
Yeah, I'm Rifat.
Rifat. Okay, Rifat. Thank you, Rifat. So I'm asking regarding this concentration, remembering, and making decisions. So this is the last point I would like to tell. This concentrating, remembering things, and making decisions. So concentrating, remembering things, who needs this most? So students.
Students.
Right? This is like adolescent psychiatry. This is the last point I want to make. Okay, many people, especially when they are doing in 10th, 12th, and now competitive exams are more like NEET exams, NEET postgraduate exams. Many people have these problems, difficulty in concentration and remembering things. So this is where another important thing, this is an early warning sign. When they tell that they are unable to concentrate, they are unable to remember things, and when they are in so much anxiety and depression, and when they have this performance anxiety that whether they'll do good in exams or not, what if they fail, what if they cannot perform well in NEET exam, so they have to sit and study for NEET exam for another 1 more year. So they will be losing 1 year of their life in again completely sitting and studying. So just imagine their fate.
Yeah, ma'am, there is also exam anxiety, which can be experienced by even a 7th or 8th student. They also feel stressed or anxiety during exams, and that's why they can't concentrate on their studies, and ultimately it impacts their performance in exams.
Yes.
They can't encapsulate, or they can't recall when they write their paper, and that affects
So how will
it.
you manage this case, Rifat?
Oh, ma'am, I don't know, because it happens with me also, not to that extreme level, but during exams I also get a little bit stressed. I get nauseatic also.
Okay. So this is like very, very common.
Yeah, this is
some part, see, when it is at normal level, everything is fine. But as I'm telling you, nowadays, if for everything, if they want a government job, they have to write competitive exams. If they want to take good seats in good colleges, they have to write competitive exams. So performance anxiety is so much. And during this time, see, when the SSLC results are out, there are suicides. When there is a second PUC results out, there is suicide. When there is NEET exam results out, more number of suicides. So, so these are the early warning signs. So two people, Yogesh Dwivedi, tell me, what is the thing? Yogesh?
Yes, ma'am. I want to ask, when we see someone means with psychotic symptoms. So
Yes.
if they are having delusions, so why they look upward and talk to people? So are they seeing persons up in the sky, or the voices are coming from there?
See, that's what I'm telling you. So when they're behaving awkwardly, that means they're reacting to their senses. See, what you are seeing, what he is seeing, he is reacting to that. But you may not see. That is unrealistic, right? See, he might be seeing something. See, I am also telling, now I am seeing you, I am seeing my camera. So now I'll start seeing this side. I'll tell, yeah, there is some snake going on, and I'll be talking to somebody. I'll start muttering. So I will be talking like this. So what will you feel? See, here there is only like wall. What madam is talking like this? So you will think, right? So this is awkward. Definitely, it is a psychotic
That is
symptom.
okay, ma'am. My question is not that if someone is in front, means if they are seeing someone in front of them and talking to them. Generally, they used to see upward in the sky or on the roof side. So why they look
Okay.
up? That's my question.
That may be just their personality, like their behavior. That's all.
Maybe see, one aspect is Yogesh. These are all pertains to what do you call mind. We have discussed so many symptoms. Ma'am has clearly, very elaborately
We
told
have to.
symptoms.
No, we have to explore it. That's all.
But this is not the end of it. No? This is not the end of it. Every day there are new aspect is coming, and new behaviors.
Not everybody looks upside and talks, sir.
Yeah.
Yes.
There are a lot of people who look down also.
Look down also.
Yes.
So it all depends.
That's what I told. It is their behavior or personality.
Yeah, maybe. So it has to be interpreted with when we see when a psychiatrist sees the patient based on the level. Okay, what is he? What is the symptom? What are the other symptoms? Taking into account, that has to be decided. In a generalized way, we cannot say this is because of this. We cannot say. Team, thank you very much, team. Thank you very much, ma'am. It is such a wonderful session. Such a wonderful session. We got to know about many aspects. Team, ma'am will put her number in the. I will share ma'am's number in the group. Okay.
And I'll give my email ID also, sir. If they have any issues, they can mail it to me.
You can just get it connected with. We are having two stalwarts from medical industry. One is Gauss sir and one is Nivedita ma'am. Emocare is really very, very happy to have you people on board. Actually, when the session was when session started, Dr. Nivedita told, see, anybody can become a life coach. That is absolutely correct. Anybody can. Even in some cases, if what is happening now, if we say, even becoming a psychologist, becoming a psychologist, it is not very, if we compare it to psychiatrist, it is not that much difficult. If somebody wants to become a psychiatrist, first they have to become an MBBS. To become an MBBS, you have to clear NEET. You have to clear NEET. After clearing the NEET, 5.5 years, you have to study. After studying it, you have to go and work as an intern in a hospital. Okay. After completing all these things, PG has to be done in psychiatry. And even in PG in psychiatry, they have to visit the hospitals and do all the aspects. And after completing all these things only, one can become a psychiatrist. So even we cannot just even compare both. I usually tell psychiatrist it is like a Everest. Okay, psychologist it is like Ooty. Both are important. Both are beautiful. Both are beautiful. But it is very nice to have two very great people who can enlighten the psychologist about the various aspects. And we have furthermore questions. And even Gausar will be joining and telling us about the various aspects. And Nivedita ma'am also I have requested for 30 minutes time. Now my NLP people are waiting, so I'm very sorry to disrupt the class.
Thank you so much.
Okay, thank you very much. Thank you very much. Thank you very much, ma'am. Thank you very much, Gausar, for.
Sir, I am thankful to you, sir, for giving me an opportunity here. And last one word, sir. Anybody have any issues, please, you can write it to me in my mail. I'll definitely reply to you. So I'll give my mail ID and number. Okay, thank you, sir.
Yeah, ma'am, in this presentation itself, you can write it, ma'am. The presentation, I will share it in the group. And Gausar will be taking a session on suicide. I tell you, team, that will be one of the wonderful sessions. I am also waiting just like you. Actually, when Ponniyin Selvan film came, okay, when Kamal Haasan and Rajinikanth was talking, that was a final moment. And for me, actually, Gausar session, it is like a Gausar session and also Dr. Nivedita. It is just like